wounds, right? When wounds heal, and I talk, if anyone doesn't know, my background is in nursing. And so when how we assess that a wound is healing is this. So someone has surgery, maybe has an infected incision or something, right? And so that incision is very deep. And sometimes as nurses, we would need to pack the wound with gauze or whatever, right? As our wound care. And so how we know um, that a wound is healing well is when that packing goes from here to here, which means that wounds need to heal deeply first before it goes superficially. And that is exactly what Deb says. It takes 3 weeks because that wound heals literally from the inside out. And this is what I want. This is the unconscious process that we want our clients to have. And like I said, Deb did fantastic with regards to this. And this is when that 3 weeks, you're like, oh shit, it's gone, right? Like that problem just falls off. The scab just heals. And so this is like the type of transformation that this type of method particularly does. So it's more like expanding into the long term instead of like the quick, because I've had that. I've been trained in traditional trainings too, where it's like, oh my God, you stopped smoking today, great. But I'd rather have a smoking client who will learn a lot of resilience in 3 weeks to 6 months, way more than the smoking itself. Because if shit were to happen 2 years from now, that smoking client, maybe they won't smoke, but they'll, if they don't know how to become resilient, bad shit's gonna happen too, right? So I'd rather them learn the skills now and like Kathy, have a new perspective and opening up that choice as you go through your list.